My name's Damon Rigdon. I'm an EMT Basic at Beaver County EMS, Beaver, Oklahoma. So the first thing is covering EMS call for our county for that shift. Usually it's 6A to 6P, and we run all the EMS calls in the county. So been interested in EMS since I was in high school. Doesn't take a college degree. You go to a specific class for this. You just find a class in your area, get signed up, start with EMTB, go through the class, go through the testing of the class, and then you have to take what's called a national registry. So after you get through the class, pass the class, then you have to go take the national registry. Once you pass that, then you can move into being hired on with a service. You know, that person, when they call 911, they're at their worst. Whether it's trauma or it's medical, they're at their lowest point. And so just being there for them to get them through that situation, get them here to the hospital, get them the care they need so that they can go back and enjoy their life. And just being able to, you know, it's not really a pat on the back, it's just knowing that you've helped somebody in their worst of time.
My name is Kate Nichols. I work Beaver County EMS here in Beaver, Oklahoma. So I am a full-time paramedic, but I am also Beaver County EMS's director. So my roles on a day-to-day basis look a little different. I do a lot of administration type responsibilities in the office, as well as taking call throughout the day. There was a need here in rural Oklahoma. We don't have a lot of extra hands, and a lot of the people that we have here don't have experience from other agencies and from larger call volume services. So it was nice to bring in a new perspective as far as this is how EMS in the rest of the state is kind of ran, and this is how we run a higher volume of calls, and kind of bringing that infrastructure a little bit here that was not here before. A paramedic in general, you have to be able to be the calm under stress. So obviously in EMS, you're working in very high stress and sometimes scary situations. You see a lot of trauma. You're typically working with patients on the worst, possibly the worst day of their life. So it's important that you bring that calm to the situation. You can think clearly through everything, and you can provide care to a person in need. EMS is very unique in the sense that you see a lot of things that most healthcare workers don't see, right? So we run calls sometimes that are traumatic enough that they never make it to a hospital. It's not something that we transport, right? So we're gonna see a lot of stuff on scene, and we have to be the ones that show up on scene and manage the scene. So again, it comes back to being the calm in the storm. So that's a huge part of it, and a lot of people are not, you know, up to that. It takes a very special person to work in EMS and to be good at it. And it just because of those challenges. I mean, you can start with just doing some ride-alongs. Get affiliated with a school. You can start with like an EMR type license to just drive the ambulance, and do some ride-alongs in ambulance and get a feel for you know, running calls and you know, being the only healthcare provider available on scene, just to kind of get a feel if that type of high-stress situation is for you. So we have 4 different levels of licensure in EMS. I'll just run through them real quick. The lowest level would be EMR, Emergency Medical Responder. That's just the provider that drives the ambulance. They can help with vitals and such in the back, but they're not going to take patient care. EMT Basic is your next level up. They are able to take a patient in the back, but they're pretty limited to the interventions they can perform. They can do basic splinting, they can administer oxygen, they can do basic patient stabilization. Your next level is the EMT Advanced. They have a little bit more flexibility as far as interventions. They can intubate a patient. They cannot use medications, but they can put a tube down someone's throat to breathe for them if necessary. And they can also establish IV access to give fluids and whatnot if needed. And then our highest level is the EMTP, or the paramedic. So we're able to do all of the things the lower levels can do, but we can also give medications. So we have, you know, cardiac medications, sedatives. We can medicate a patient to intubate them if needed. There's a lot more options as far as treatment on the paramedic side.
So my name is Sydney Looper, and I am an EMT student currently working with Beaver EMS. What drew me to EMS is just how quickly you have to make decisions. I think that's really interesting to me. You have to kind of really know your stuff really quickly. And of course, all the science behind it, and just a fast-paced environment. I found I like the not set schedule, kind of just being called whenever we're needed. So really love the self-paced program because it allows me to take my own time. So if I wanted to work at 3 in the morning, I was able to work on school. And then I'm doing about 3 days a week here at Beaver EMS. So I'll bring my school with me here, work on it throughout the day, and ask questions. It's really nice to be able to work here and have a paramedic sitting here with me, so I'm able to ask her all sorts of questions. She's able to help me through school. But the self-pace has been really awesome. I'm able to go as fast as possible. I'm trying to get on as quickly as possible. Yeah, what I definitely think is special about EMS is definitely the flexibility and just the fast-paced environment, the adrenaline. I feel like that would be a lot different than working in a set hospital situation. Obviously in a set hospital, you're just on the floor doing your rounds, but in EMS, you're driving all over the place, meeting people where they're at and trying to get them to the hospital as quickly as possible.
My name is Pat Dodson. I am the Apollo 4 base manager. I'm a critical care flight paramedic.
My name is Amber Balzer. I also work for Apollo out of Porter, and I am also a flight paramedic.
So I actually started out as a volunteer EMT in a town of about 400 people. Really had no thought of this being my career till the first time on a car accident where the helicopter landed and the flight crew got out and everything calmed down and the patients got taken care of. And then at that point, I knew that's what I wanted. So a flight paramedic is the highest level of training in EMS, and we do what they do in the ER flying through the air.
I think it's pretty unique because we get to go almost anywhere, you know, in a quicker time. And we get to see different kinds of patients, sometimes more critical patients than you would see on the ground, or maybe like in the ER. And you get to be the one that shows up to help.
So our partnership with our local EMSs is really unique. I've always thought of the flight crew and the helicopter as an extension of that ground ambulance. We're fortunate on some of the equipment we get to carry that is not feasible for ground EMS, and we can get that higher level of care to that patient faster. So most of our partners are going to be rural, because that is one of the most precious commodities we have is time. And that's the big benefit of the helicopters. We get to the patient faster and we can get them to the hospital faster. In an urban setting, you know, you're looking at a 10 to 15 minute transport, where in rural America, your short transports are 30 minutes and you're hours away from a level 1, level 2 trauma center. And that's time that patients don't have.
So I started in a small town too, about 7,000 people. And what got me into it is I just took a CPR class one day and I got on with the volunteer fire department. And I ran one of my first medical calls and actually got to get in the back of the ambulance and help transport that patient to the hospital. And after that, I would say I was hooked and I wanted more. And so I went ahead and took my EMT basic class in person, which there are online options too, and then just kept going. So after I did that for about 4 years, I did my paramedic online and then passed that. And then I was in a busy service for about 3 years as a paramedic on the ground. So on the ground, I worked next to the flight crew, and every time they would show up, they were ready to help. And it was always just a breath of fresh air when they came to help us. So that's kind of what made me want to do it, is to be that breath of fresh air for someone else and the relief.